Welcome to today's lecture on the nursing care of patients experiencing seizures. Seizures can be a daunting and critical event, requiring prompt and effective nursing interventions to ensure patient safety and optimal outcomes. Let's explore the details of seizure nursing care, supported by practical examples. First, let's understand what a seizure is. A seizure is a sudden, uncontrolled electrical disturbance in the brain. It can cause changes in behavior, movements, feelings, and levels of consciousness. Seizures can be classified into two main types: focal, partial seizures, and generalized seizures. Focal seizures originate in one part of the brain, whereas generalized seizures involve the entire brain. Now let's discuss the key aspects of nursing care for patients experiencing seizures. During a seizure, the nurse's primary goal is to ensure the patient's safety and prevent injury. Here are the immediate steps to take. Ensure safety. Move objects away that could cause injury. Protect the patient's head with a pillow or soft object. Do not restrain the patient or put anything in their mouth. If a patient starts seizing while in bed, remove any nearby objects like side rails or call buttons that could cause injury. Place a pillow under their head to protect it from banging against the bed frame. Maintain airway. Position the patient on their side to keep the airway clear and allow saliva to drain. Loosen any tight clothing around the neck. If a patient is having a tonic-clonic seizure, turn them on their side in the recovery position to prevent aspiration and ensure their airway remains open. Monitor seizure activity. Note the time the seizure begins and ends. Observe and document the type of movements, duration, and any loss of consciousness. Record the start and end times of the seizure. Note whether the patient had stiffening and jerking movements, tonic-clonic, or if they were staring blankly and unresponsive, absent seizure. After the seizure, also known as the postictal phase, the patient may be confused, tired, and may not remember the seizure. Here's what to do next. Ensure patient safety. Keep the patient on their side until fully awake. Reorient the patient as they regain consciousness. If a patient is confused and disoriented after a seizure, stay with them, offer reassurance, and help them understand what happened. Perform a head-to-toe assessment. Check for injuries sustained during the seizure. Monitor vital signs and neurological status. Check for any bruises, cuts, or fractures that may have occurred during the seizure. Assess their level of consciousness and motor responses. Document the seizure. Record details about the seizure and the patient's condition post-seizure. Notify the healthcare provider about the seizure event. Document the duration, type of seizure activity observed, and the patient's condition after the seizure. Communicate this information to the physician for further evaluation. Long-term care and patient education are essential components of managing seizure disorders. Here's what you need to focus on. Medication management. Ensure the patient takes anti-epileptic medications as prescribed. Educate the patient about the importance of adherence to their medication regimen. Educate patients to take their medication at the same time every day and discuss potential side effects. Use a medication diary to track doses. Lifestyle modifications. Advise on avoiding seizure triggers like stress, lack of sleep, and alcohol. Encourage a balanced diet and regular exercise. Teach patients to establish a regular sleep routine, manage stress through relaxation techniques, and avoid excessive alcohol consumption. Seizure action plan. Develop a personalized seizure action plan with the patient and their family. Include steps to take during a seizure and emergency contact information. Create a detailed action plan that outlines what family members should do if a seizure occurs, including administering emergency medication if prescribed. Safety precautions. Advise on safety measures at home and during activities. Encourage the use of medical alert bracelets. Recommend using padded furniture edges and avoiding activities like swimming alone or operating heavy machinery without supervision. In conclusion, effective nursing care for patients with seizures involves immediate interventions during a seizure, thorough post-seizure assessments, long-term management, and comprehensive patient education. By following these guidelines, nurses can help ensure the safety and well-being of patients with seizure disorders. Thank you for your attention. Let's continue to provide compassionate and skilled care